start with my script.
Okay, we're connected. You can start.
All right. Hello, I am Linda Heitzman-Powell, and I serve as chair of the Behavior Analyst Advisory Committee of the Kansas Behavioral Sciences Regulatory Board. I ask the members of the advisory committee to respond to a roll call to signify their presence at this open meeting that is being held remotely by conference call and other electronic medium. Denise Seisman.
Present.
Allison Bell.
Present.
Alec Bernstein.
Present.
Wes Dotson.
Present.
Kelly Harrison.
Present.
Emily Kessler.
Present.
Pamela Neidert.
Present.
Christy Marie Steele.
Present.
Stephanie Wiley.
Present.
Mike Williams.
Present.
And Alice Zhang.
Present.
I note the following BSRB staff members are also present. There's Leslie Allen and David Fye.
I'm here.
All right. Next, David Fye will read a message concerning this meeting being held remotely.
Thank you, Linda. This is David Fye, Executive Director for the Behavioral Sciences Regulatory Board. Public comment allows the public to address the advisory committee about any concerns, but the Kansas Open Meeting Act, or the KOMA, does not require the advisory committee to provide public comment or answer questions from individuals. Individuals requesting to provide public comment could contact the Executive Director prior to the meeting by sending an email to david.fye@ks.gov. There will be no public comment at this meeting as no individuals requested time for public comment. Because we are conducting this public meeting remotely, I state for the record the following information. Access to this meeting is being conducted by medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call or viewing the board's YouTube channel. While the meeting is conducted remotely, the requirements of KOMA are not suspended. As such, we will be conducting this meeting pursuant to the KOMA. On March 12th, 2025, we sent notice of the meeting to all individuals who had requested notice of such meeting. The notice was also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other media material have been posted on the board's website and are available for review. You may also request a copy of the agenda specifically by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and YouTube channel that allows the public to attend the meeting free of charge. The notice also states that if we have any technical issues during the meeting, you may call or contact the board office by sending an email to bsrb@ks.gov. A recording of this meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And I did check the conference call line before we got started. There's no one currently on the line, but if I hear someone beep over and introduce or announce themselves, I will let you know.
Thank you, David. The meeting is now called to order, and the advisory committee will begin its discussion of the first agenda item on the agenda, which is the agenda approval. Do I have a motion to approve our agenda?
Motion to approve.
Thank
Motion to
you.
approve.
With a second?
I'll second.
All right, all in favor?
Aye.
All opposed? Motion carries. The agenda is approved. The next item on the agenda is the review and approval of our previous board meeting minutes.
I move that we approve the previous board meeting minutes.
Thank you.
Second.
Do I have a second?
Second.
All in favor? Aye. Aye.
Aye.
All opposed? Motion carries. Thank you. We will now move on to our executive director's report. So I'll turn the meeting over to David for that report and the next agenda item, which is the annual training for the board. Oh, wait, I'm looking at the minutes, which is the executive director's report and the information from the behavior analysis regulators meeting that we had in Dallas, Texas at the APBA conference. David?
Yes, thank you, Linda. So first, a few updates about BSRB operations. So we have fully transitioned to using CE Broker as a tool for licensees to save copies of their continuing education documentation. Recently, I've received a few questions about that, so I thought it might be helpful just to kind of clarify a little bit. What the e-broker is, that the company that contracts with different state entities, licensing boards like the BSRB, and it provides a service to basically licensees so that they can upload copies of their documentation when they complete continuing education hours, so that if they are selected for audit, instead of the normal process where they would be mailing things back and forth or emailing things back and forth to the board to verify the hours have been completed, if they're uploaded in the portal, the licensing board can log in, verify those hours, verify that they're in the right categories, and then the audit can go much smoother for both the licensing board and licensees. There are different models used by different states. And so recently I've received a couple of questions from people who thought we were using a different model that some states have adopted. There are some states that audit 100% of all of their licensees upon renewal. Here in Kansas, we audit 10%. And so there's other states also that have made the e-broker a requirement, and they basically said, we're going to require all of our licensees to use the tool. There is no exception. That's not the path that the board wanted to pursue in Kansas. And so what the board decided to do was to make this an optional service, but have people opt in. And so there is an account created for all licensees, and I do think it's a good service. And so I encourage all licensees to pursue it. That is an option for people to make that decision for themselves. And so if they would prefer not to do that, and then they renew their license and get renewed and are selected for audit, they still have the method we've been using for the last few years of sending stuff back and forth to the board to verify the hours have been completed. So that is still an option for any licensee. But I do think it makes sense to use the e-broker services. They are free. There are some optional paid services that people can opt into if you want to go to a higher tier account with the e-broker, but that is entirely optional. One thing we made sure of in our agreement with them was that no one would be required to pay for the use of the e-broker services. But what they have found in the past is that individuals voluntarily chose some of the benefits of having the higher tier services. So that is how they make their operating revenue. But the agreement with the board was free for the licensing board, and it was free for licensees. So just wanted to clarify that in case there was any confusion or if you've heard any questions from individuals. Also, if any individuals have trouble with the system, I would ask them to go ahead and just contact me directly, and I can help them out. I know we've also tried to implement our CE providers for social work to use the portal to go ahead and register, and there have been a couple of bumps in that process. So we're going to be meeting with people from CE broker to see if we can work out those items. But for licensees, the most of the feedback that I've received so far has been positive. I think people appreciate having that as a free service. I know as someone who does continuing education hours for my law license, it's only, we renew every year, and it's a different process. But having to hold on to those records and not knowing if you're going to be audited or not, I think this at least provides a good place for them to be in a secure location. And I think it's a pretty good tool that you can assign them in different categories too. So even that is kind of split up. But like I said, if you've been hearing of anyone who's having trouble with that, just go ahead and let me know, and I can work with them and CE broker and see if we can resolve those issues. In terms of other operating items, we've been doing a lot of work behind the scenes here recently, switching over to prepare for the licensing transition to the new provider, Acela. We made a conversion from our licensing system from an Access database to using My Licensed Office software back in 2020. And we are now going under the state system under Acela. And so it's going to take about 2 years. We're about 6 months into the process. There's several agencies ahead of us, but they've already been doing a lot of work in terms of the discovery phase, going through all of our existing forms and processes, trying to learn all those so that they can look for efficiencies and make sure that we're not duplicating efforts. And then they're going to build a system with Acela that'll work out pretty well for us all. So you may not see any changes for a little bit of time, but I want you to all know behind the scenes, Leslie and a lot of licensing staff and other individuals have been meeting with them and working out different things. And we're also not just trying to work on, some of the benefits of moving to this new system will be that we'll have people be able to apply for licensure electronically versus what we currently have now, which is still the paper method. We will also have some of our other functions automated a bit more, such as people when they submit approved training plans to see clinical level licensure for a lot of the professions. So we're trying to take some steps forward, and we'll keep you updated on that process as it moves forward. In terms of moving to some legislative updates, so this is the part of the process where the legislature meets every spring. Usually they meet for about 90 days. They generally start their session the second week in January, and then they go until about the middle of April or the middle of May, or sometimes the beginning or middle of June is the farthest that I've seen it out. And this year they wrapped up their session just about a week ago. They had left for about 2 weeks to allow the governor time to review the bills that had been passed so far, to have the governor make decisions about signing those bills into law. If the governor does not take action, those bills eventually go into law without a signature, or the governor can veto legislation. When it comes to things like appropriations bills, the governor also has the ability to do something called a line item veto. And so the governor did consider an appropriations bill from the legislature. It was Senate Bill 125. And the governor did ultimately sign that bill, but did 31 line item vetoes. So when the legislature returned for a 2-day end of the session omnibus period, they went ahead and considered some of those vetoes. The Senate went ahead and packaged them all together and did a motion to overturn the vetoes. To overturn a veto, it takes 2/3 vote in both chambers, and the Senate had sufficient votes to overturn all 31 of the vetoes, line item vetoes on the budget bill. On the House, initially they bundled about half of the line item vetoes, somewhere between 15 and 18 of those items, and then voted and did not have sufficient vote. But then the following day, they reconsidered that motion and then had sufficient votes to go ahead and overturn about half of those line item vetoes. So the budget bill has been now passed. Half of the line item vetoes have been overturned. The other ones stand. There's also a number of bills that were signed into law. And so we're still trying to sort through some of those different things. What happens sometimes is you have an original bill that's introduced in one chamber. It will sometimes get a hearing and then be passed by the legislature. It'll go to the other chamber. It'll get passed. If it's passed in 2 different forms, ultimately they have the option to agree to the second chamber's modifications, or it can go to something called a conference committee, where 3 members of each committee on the House and the Senate come together and work out items of difference. So when you have a conference committee, that really opens things up to a lot of changes. You have the ability to bundle bills together in conference committee. So you might have 3 different bills that were originally Senate Bill 1, Senate Bill 2, and Senate Bill 3. But in conference committee, they might say, let's take the language of 1, 2, and 3 and put them into the shell of Senate Bill 1. And then once you put something into a conference committee report, it goes back for the legislature to vote on in both chambers, but you can no longer change it. So that's one of the legislative tools, is that when you get something to conference committee, those leaders of each committee decide on the final version, and then ultimately the members of the House and the Senate can only say, yes, I'm going to vote for this entire packaged bill, or I'm not going to vote for it. And so, but it does make it difficult if you are tracking certain legislation. There's not an easy map to find on the legislative website that says if you're tracking the language of House Bill 2274, that is now in House Bill 2280. So we're sort of going through and trying to find pieces of bills and see where everything ended up. But ultimately, from what I can see so far, there's not a lot of bills that deal with the mental health community in Kansas. There are a few that did pass. One of the bills would exempt military spouses from licensure fees. There was a similar bill that had passed a year or 2 ago, but it dealt with active duty service members. This bill primarily just struck the word active. So it broadened the group of military spouses that would be exempt from licensure fees. And that's not just for the BSRB, that goes for other regulatory bodies as well. There was a bill that will create a mental health hospital in the South Central region of Kansas. And that bill did pass, so that they will take steps to go ahead and start implementing that. The reason I bring that bill up is, even though that doesn't directly affect us, I think when they start looking at how they're going to staff that facility, I think they're going to have to look in creative ways to make sure they have sufficient individuals to staff that facility. And so we will probably feel some additional pressure when it comes to licensing agencies. And we have been working to help in terms of workforce, but I think that will be something that will be a priority for us going forward. So that's the legislative actions. In terms of the BSRB bill, unfortunately, this year that was not able to go before the legislature. We had a bill that was provided to the revisor's office to be drafted. We had asked them to go ahead and let us know when that's ready. Unfortunately, based on the number of bills that they received, we did not get that back in a way that we could introduce it with sufficient time for us to get a hearing in the House and the Senate. So those items basically are ready for us to go move forward on, but we'll have to wait until next year. I did have conversations with leaders of the House and the Senate, and it sounded like they were supportive of most of the items in the bill. It just came down to sort of a weird timing crunch this year. The legislature did do some things differently this year, and they moved forward more quickly in certain ways, and they used some unusual processes. We've talked about that a little bit with the budget process. Normally, what happens is agencies submit a budget in the fall, then the governor's office reviews all the information, comes out with their recommendations, and then the governor's recommendation is usually the starting point for the budget process. And usually those budget hearings start about the first week in February. This year, the legislature decided to change things, and instead of using the governor's recommendation as the starting point, they held individual special meetings in the fall of last year and decided to use their own starting point as their starting basis. So the governor did still come out with a bill with a recommendation, and during those committees that they did still sort of mention what the governor's recommendation was for certain expenditures, but the legislature took a different path and used a different process this year. So they also in the past have looked at the 90-day session requirement a little differently. Sometimes they have said, we're not going to count weekends, or maybe let's not count Fridays where we're not having committees meet. Some of those are called pro formas. This year, they really worked to have a condensed schedule, and they counted the 90 days a little bit earlier than in traditional years. And so there was really a push to get things done quickly this year and complete the session, and they have, but it did mean that some things weren't able to get through. So I am optimistic we're not going to have the same issues that we had this year, and we'll be able to consider other items to add to the bill and hopeful that it'll go forward next year. So in terms of the budget process, though, for the BSRB, our budget went through. There were no provisos this year. There were no changes from what we had requested. We actually came in under budget, what we were approved for in the current year. We came in about $40,000 lower. And that is something that I had told the budget committee last year. I said, I'm trying to estimate increases for things like, different inflationary costs. But if these things don't materialize and we can have savings, I will come back to you and let you know that. And so that is what I did. I went forward, and the budget committee recommended the same amount that we had requested. And then they went ahead and approved that in the House, and then the Senate didn't make any further changes. So our budget is consistent going forward. So from a budgetary perspective, we're in good shape. We've got about $1.8 million or so in our fee fund, and our budget expenditures for the year are about 1.2. So we have a good balance right now, and we're looking good moving forward. In terms of just other items I wanted to keep you aware of, I always try to let you know about items from the board meetings, and the board did have a board meeting last month in March. Two of the big items the board is focusing on all of your work that you did as an advisory committee for the unprofessional conduct regulations. The board is now at the part where they're comparing across the professions for those different items. And so I've worked with some of my staff members, and we've put together a grid of all of the different items from all the 7 sets of unprofessional conduct regulations to be seen side by side. And so the board can walk through those items together and decide, do they want to modify the language so that it's consistent across professions, or do they want to allow some of those to be different based on the unique aspects of each profession? So that's one of the main things the board will be looking at. And then also we've had a recent conversation with the board about some language for an expedited application review process. And the board did go ahead and have some, they were in support of some language that we had talked about concerning a way that we can review some information up front and then be able to tell people, if you want us to make a decision right now, here is how your application looks, to meet sort of the outline of that process. But we'll need to put that process into regulation before we can use it. But I think we are making good steps forward on that. So with that, I'll go ahead and, the only other big item we've been working on recently has been the draft surveys for all the professions. So we did put those together and sent those out earlier this year. We did that for 6 of the professions, and we sent out slightly different questions for each level of license. So we do have the draft survey report for you to review today. Just to let you know, one other thing behind the scenes we've been doing is we've been replacing some technology, and we're working on an update for my own computer. And so because of a technical issue, I'm not able to open up PDFs while I'm broadcasting meetings. So when we get to that part of the agenda, if someone could pull up the PDF of the draft survey report and then share their screen, we can walk through that together. So I'll just put somebody on alert for that. But really excited about those draft survey reports. I think we've put together 5 of those so far. And we've been meeting with a lot of the different advisory committees and walking through that. Ultimately, when we came down to the final language of the survey, we did try to get some standardized language as much as possible so that we could compare across professions as well. So there will be, ultimately, when all is said and done, a survey report per profession that talks about the different levels of licensure. And then we'll have one summary report where if we have similar questions across professions, we'll be able to compare that too. So I'm pretty excited about it. I've had Emma and Tyla, 2 of my staff members, working on a lot of the summary information in those reports, and they've been doing great work. So I'm excited to walk through the report for behavior analysis later on today. So I will end my report and see if there's any questions on any of those items that I talked about.
Does anybody have a question? I do. Sorry. Okay, so this is the second time that we've tried to get stuff through the legislative process. And so is there a way that we have the ability to work on wordsmithing or talking to people about it beforehand so that and I don't even know if this makes a difference, but that we have that legislation ready to present as soon as the session opens, and then also maybe a discussion about which committee that it should be introduced to. There was one that you mentioned that had people on both sides at that committee, so it's more likely to get pushed through. What was that?
Well, when you say it's been 2 times, so we did have a bill that did go before the legislature in 2023 that would have added a behavior analyst to the board. And that bill ultimately was passed, at least most of it.
But they cut it out.
Yeah, the committee removed that. They moved a few different portions of the bill before they passed it, and they added some different language too.
Right.
So that one, it did go through the process. This is a very unusual thing that happened this year. I've never seen this before. The thing is we don't have the ability to request or to introduce legislation as a licensing board. Ultimately, it's up to the members of the legislature in terms of their process. And so we can make a bill introduction request, but some of those committees have different processes. And so normally there are some committees that let us go to the microphone and say, on behalf of the Behavioral Sciences Regulatory Board, we have a bill request. And then there's something called an RS number, which is the Reviser of Statutes number. When it's to be presented and introduced in committee, that is a number you have to provide. And unfortunately, that was what we didn't get. And so our draft wasn't ready from their office for us to actually provide that information. And then other committees basically say, no, we don't allow people to go to the microphone and make those types of requests. Behind the scenes, you need to go to members of the committee and get a member of committee to essentially vouch for your state agency or association or organization, and then have the member of the committee do the official bill introduction, which
Mhm.
we had behind the scenes. We did go through those steps and we had that agreement. Unfortunately, though, by the time that we had the bill draft ready from the revisor's office, and we had that information, and the member of committee had agreed to do the bill introduction, it was past one of the legislative deadlines, and so they couldn't actually introduce it in committee. And then there are some exempt committees that don't have deadlines, but by legislative leadership, they basically were telling members of the legislature that they didn't want a lot of bills introduced after that point. And so we sort of ran into some really unusual roadblocks this year. But
Right.
since it's already drafted and it's already ready, it shouldn't be an issue next year. At the very beginning of the session, we should be able to get it introduced because it's not the same issue that we had this year. So.
Well, and so then the question would be, since it has to be introduced by one of the legislators, should we identify and on the back end court a backup legislator in case something untoward happens to the current legislator, so that next year we don't, get to that point and not have somebody that we've talked to. And so that's sort of question one. And question two would be, is that something that you do, or is that something that a member of the committee could do? Is that, I mean, I'm not really sure how far our jurisdiction allows us to go, right? But I know that there's members on here that would be willing to be that person that would go talk to someone. So
Yeah, I think what
what's
guidance
your
would
take on
say-
that?
Yeah, as far as that goes, I would say you want to be careful that unless you're delegated to speak for a certain group, that you're not speaking on behalf of the group. For example, the board delegates to me to go to the legislative committees and speak on behalf of the board. And in certain situations, the board might also say we would like a member of the board to come to the committee and speak to. This advisory committee, we've talked a little bit about, it's not really an advocacy group. It's really to support the work of the board. But I do think that there is a lot of value in building relationships with members of the legislature. So there's nothing wrong with that. I think it just, you need to be careful. You can say, I'm a member of this group or I'm a member of this committee. It's just, you can't really say I'm speaking on behalf of the committee unless that is something that really the board has authorized. So,
But is that something that outside groups could then pressure the board to advocate for? So like our Kansas Grassroots Effort, Kanzaba, some of these other behavior analytic groups, is that something that they can ask the board to then ask to do? I think is the question.
Yeah, I think so. I mean, sometimes we have groups that speak to the board and ask for time for public comment, and then ask the board if the board would support different things. And so I think building the relationships with members of the legislature is good. I just think in terms of guidance, I would just say if you're a member of this committee, it's okay to mention you're on this committee and that you're supportive of this. If you're parts of different groups, you could also say, we know the board is going to be bringing forward a bill with this. We really are supportive of this, and that's why, that's kind of the line that I would probably recommend walking.
So I think what that means then, and correct me if I'm wrong, that individual members of this advisory committee could talk to the legislature on behalf of behavior analysts in the state of Kansas as a licensee and a member of a different group. They could mention that they're on this committee, but just say that we've been licensed since, what was it, 2016? Somewhere around there. And while we are regulated by the board, we don't have representation on the board. And so that the cost is minimal. It would be, how much would it be? You get money if you drive there, right? I don't even think I've ever it's like what, $20 or something?
But yeah, the cost, if we were to add a board member to the board, it's not a big cost. Board members get $35 per day for officially approved meetings. And then if there is an in-person type thing, there's reimbursement for mileage, basically, and per diem if you're traveling on behalf of the board, basically. But for most of the monthly expenses, it would just be a $35 thing every couple months, usually. So
Yeah, so it's less than $100 a year is what it is, I think, and I don't even know if I've ever gotten it, but it's not the money, right? That's not the point for us in general, I think. I think the point for us in general as a field, as a class of licensees would be that we do have representation on the board. So I'm just trying to think to next year, and what are some of the steps that we could proactively take that fit within the guidelines of being a member of a legislative regulatory body, right? And that could potentially make it a little bit easier next year for this to pass.
well,
So that it doesn't all fall on you, right? So that we're not, because it's not like, David, why didn't you get this done? It's,
Yeah.
and so what can we, I guess the question is, what can we do
Well, I would say,
within the confines of?
yeah, usually the one of two committees where our bills are generally introduced, or and we could ask for introduction in a different committee, but legislative leadership would probably assign it to certain committees. And what usually assign our bills would be the health committees. So for the House, it would be the House Health and Human Services Committee. That's currently chaired by Representative Will Carpenter. And then on the Senate side, that is the Senate Public Health and Welfare Committee. And so those two committees, I would say, talking to the members of those committees is probably a good place to start.
Okay.
And I have not received opposition. I actually got a little creative and reached out to the chair of Senate Ways and Means, even because that is an exempt committee, to see if that would be a way for us to get our bill in towards the end of the session. But at that time, it was kind of a matter of the clock running out. So
Yeah.
we've been able to get it introduced and maybe even a hearing, but for it to go through all of that on one side and then back to the other side, and then through that, it was just it was not sufficient time this year.
Right.
But I do
Yeah.
think, making those connections and talking to members of those two committees is probably a good place to start.
Would you say their names again for those of us that may want to write it down?
Yes. So the chair of the House Health and Human Services Committee is Representative Will Carpenter.
He's from El Dorado.
He's from where?
El Dorado.
Oh, there you go.
And on the Senate side, the chair of the Senate Public Health and Welfare Committee is Senator Beverly Gossage.
How do you spell her last name?
Gossage.
Okay. Do you know where she's from?
Not off the top of my head. If you go to the legislative website, though, and you go to the individual members, it should show what district or area they represent.
Yeah, so Allison is a member of the Grassroots or Consaba or something. You could find out where she lives and find a behavior analyst that lives in her area to go grease the wheels. But
I've already got Will's email for a different thing, so
Okay.
he's getting an email from me this afternoon.
all right. Well, thank you, David. And I understand the legislative process a little, but not enough to be fluent at how we can work behind the scenes to be able to help support it. I mean, we all talk about it, put your money where your mouth is kind of thing, like what can we do to support it? So.
Yeah, and basically in the past, what we have done is we've reached out. So in order to even speak with the revisor's office, which is the body that drafts the legislation, you need permission from a member of the legislature. So we had conversations back in December with Representative Will Carpenter and got his permission to speak with the revisor's office. We met with them. We gave them the language of all the items we needed. Those were all finalized the first week in January. And then we were waiting on that bill draft and the RS number.
Right.
And I knew they were getting buried because of the unusual nature of the session. And as a learning thing for me, I could have been more of a squeaky wheel, but I know they're getting that from a lot of other angles. So I was trying to take a little bit of a hands-off approach. But I think next year, if we're anything close to that, I'll take a different approach just to make sure that things move forward. But I was trying to, work positive relationships in lots of different areas. And,
Yeah. Well, and I
I-
think it's important for us to recognize that you fill a unique position, and you do need to maintain that positive relationship, right? And as private citizens, we can be a little bit more vocal maybe about what it would mean to us as a designated licensee group to be able to have representation on the board.
Mhm.
So that's just my 2 cents worth. I mean, the whole process is, current state of affairs is next year it might just be who knows what. It just all gets passed without vote. So just my 2 cents. All right. Having said that, does anybody else have any questions for David on that executive report or the legislative process or how we can help with that? No? All right. Thank you very much, David. And so now you want to talk about APBA?
Sure, and I'll make one comment too. I probably should have included this in my main report, but each of you serving on the advisory committee, we really appreciate all that you do. This is really helpful in terms of the way the board is structured and having the advisory committees, because we can have input and good conversations and dialogue with different professions, and then those recommendations can come back to the board. So we can kind of work as 7 agencies in one per se, but also still have a large group of individuals that are part of the dialogue and conversation. With that being said, we have 2-year terms according to the advisory committee policy. Normally about this time of year, I talk to each of the advisory committees and I say, would you like me to put out a letter or a message to licensees to see if they'd be interested in joining the advisory committee? You are at a current spot to where your advisory committee is maxed out membership wise. You have the board member who serves as chair, which is Linda, and then there's a public member, which is Denise, and then you have 10 individuals that are non-board members, and that's the max you can have. And so there's currently no open spots on the advisory committee. However, we are trying to keep an eye on those 2-year terms. And so for individuals who are coming up upon the end of your 2-year term, what I will be doing here in probably the next few weeks is reaching out with emails and just checking in and saying, we appreciate your work on the advisory committee. Your term is going to end at the end of June. Would you like to request reappointment for another 2-year term? And
I beat you to that. I'm so sorry. I literally just emailed you.
I saw your email and it was a good reminder because that is something that's been on my radar. And in the past, I think several years back, the terms were spelled out in the advisory committee policy, but they kind of all blurred together. And we've really been trying to do a little bit better job of calling those out. So that way we can ask people, do you want to be reappointed for another 2-year term? And then none of your members on the committee are going to be reaching the end of their 4 terms of eligibility by the end of June of this year. So you all would be able to keep the advisory committee membership consistent as long as everybody wants to be reappointed. And so I'll reach out to each of you, and then ultimately it would be the chair of the board who would appoint people for another term or reappoint people. And so that would be something that would happen at a board meeting, and that would probably happen at the next board meeting, either in May or if not in May, in July. So I'll be expecting some emails from me.
And it's the chair of the board, not the chair of this committee, so it's not me.
Correct. There's the conversation there, but it's ultimately the chair of the board who has that authority. So, in terms of the next item on the agenda, really excited to talk about that. So for the 2nd year in a row, Linda and I have been able to go to a conference for Behavior Analyst Regulatory Board. And that was part of the Association of Professional Behavior Analysts Conference. They had a different section Last year, they had most of a day that was dedicated to this process, and we had a lot of individuals from different states. And then we were able to attend the remainder of the conference. And then this year, we were able to participate in a meeting with individuals from licensing boards and then attend the conference as well. I found it really interesting, especially there were some representatives from some different states that do not currently license behavior analysts. And it was interesting to talk to them and hear about some of the issues or the obstacles they're facing. And also they were kind of collecting advice and guidance for whenever, they do put forward a bill or they take another shot at getting licensed, what they could include in their statutes, or maybe some issues that we've experienced they could learn from. And so it all gets put in the best way possible the first time around, because we've done a couple of cleanup efforts over the years. And so it was interesting to kind of hear from some of those individuals. And so before we talk about the main part of the conference, Linda, did you have any other comments from the meeting we had with the regulators for the behavior analysts across the different states for that?
The one of the issues that came up was the BACB's response to some of the executive orders that have come out of Washington, and requested clarification for why some of the language was changed. And they spoke on it in terms of that the intent of their stance on things is that everybody is still included, but they removed specifically the term DEI because it is such a politically charged term at the moment. And so I think that to speak professionally, that they were concerned, they just had a concern that by not modifying their language to continue to promote the intent of DEI while removing the term DEI, that it would inhibit their ability to be able to remain active and proactive. And what else did you get out of what they were saying about that? They said just a little bit on it and then moved on, but
yeah, and this is something that a lot of the different professions under the board are working with as well. So the Federal Register is probably the best place to read the exact language of the executive orders. I was on that website a little bit earlier today. It does have, they have a pretty good list of all the executive orders for all presidents, I think going back to 1937 with FDR. And so you can see them all even by year, and you can see PDF copies or CSV copies. But that's a pretty good place if you have any questions about specific executive orders. I think so far, President Trump has issued 129 of those. So it is challenging to track all of the different ones, and there's lawsuits involved with different ones. And an executive order is different than a law in certain ways. And so I think a lot of different groups are wrestling with it. But I think what's also been interesting for me as someone who is an attorney and not educated and licensed as a mental health practitioner, it's been interesting to kind of see the discussion about the term DEI and what wrestling with some of the core values and what the definition of some of these terms might mean today versus maybe in the future, and what is really at the heart of some of the policies. And so that has been interesting. There was an individual from KCREP, the accrediting body for professional counseling, that I recently heard kind of share some thoughts, and they're also working with kind of wrestling with the same concepts too. So I think there's a few different groups that are wrestling with these directions and directives. So it's not just behavior analysts that will need to work through this. I think probably all the professions in one way or another. But it was interesting to kind of hear some of their comments from a high level, and then also the kind of agreement that this kind of conversation is going to evolve, and it's going to take some time for us to work through a lot of these different things.
Yeah. So that, you know, that was a point that I thought was noteworthy. And so, and it's just really interesting because you're attending that regulators meeting. It's easy to see how decisions that are made can affect individual practitioners, and how historically individual practitioners have a voice in promoting the inclusive agenda, but also how it's almost like the people that are at the level of the members of the BACB that were there are sort of in the middle between some of these federal executive orders that are coming out and the practitioners, and trying to be able to navigate that, like David said, in such a way that it that we still operate within the intent and the ethics of our professions without putting ourselves at risk of some type of adverse action. Yes, ma'am.
Was there a recording of this conversation? Because I think I'm struggling understanding why the BACB has done this. I have read a lot about it. And so the fact that you got to like hear someone talk about it is very exciting. But I would love to know more about the rationale behind it, because it feels very like compliance in advance to me, and that sucks, honestly. So
Well, if you're an APBA member, you can have a free download or free watch of the recording.
okay, there is a recording of it then?
Is there a recording of that regulatory meeting?
There
Alan?
should be, I think. If you're
They didn't, I don't think they said it was being recorded, but
maybe that one was not. If
yeah.
you're in the BACB's decision-making process, they put out on their podcast a reason.
Yeah, but yeah.
I know there is a recording of the talk that happened at APBA from the director of the goodness, going blank now.
The
Yes,
BACB?
the BACB. All my acronyms got jumbled up there. It was like the first talk on, I want to say Thursday. I tried to go to it. The room was full, so I had to sit outside and listen to it on the computer. So it'll be available on Behavior Live. You can listen to that, and they explain the whole
Off I
deal.
go to download. Thank you guys.
Yep. That's a little bit different. I was not able to attend that one. That's a little bit different than the meeting that I was at. And so, yeah, I just think it's something as an advisory committee, like we need to be aware of all of the different influences on our field and our practice. And so that we're well informed if we get to a point that we have to advise on something, right? And this is one of those things. So, but that's my only comment on that. Rest of the conference was great. We got some good pictures, did some fun stuff. They had good food.
Yeah, we got a nice picture with Mike in front of one of the signs for the conference, and I didn't see him there.
And the one thing that I want to say about that conference, I so needed to go there because it's really easy. I call it the Mary Poppins effect. I usually can take something and turn it around into something fun and exciting, right? But I'm not feeling that the last couple of months. And the conference was it was like, what was it called, Alec? The Sparkle Conference, Mike? It was something.
Something
And
Shine.
Shine.
Yeah.
There you go, Shine. And the everybody there, the focus was on, it was very uplifting. The focus was on being positive. The focus was on, you know, continuing to do good in the world. It, you know, it definitely was a feel-good conference. So I think focusing on mental health. They did have one thing that I never went to. It was like a puppy reunion or something where they had a bunch of puppies there and you could go adopt a puppy or something. It was kind of cute. I wasn't able to make it, but
I miss the puppies as well, but from a licensing perspective, but one of the items that I found interesting, there was some information that was presented as far as behavior analyst licensing trends, and I mean, your numbers as a profession are continuing to go up and up and up, and that doesn't seem to be leveling off anytime soon. So I think your profession will continue to grow, and I think that will lead to more recognition. And in terms of RBT, which were relatively new to me last year as I dig more into the history of your profession, it does not seem to be a trend of states regulating RBTs. That is one thing I wanted to keep an eye on, because the ones that have regulated those individuals, there are a lot of them that appear to be providing services, but not a lot of states that really regulate RBTs, at least through licensure. And that doesn't seem to be changing. So I don't think we're, you know, I always try to keep an eye out for, you know, is Kansas, are we following the trends? Are we the outlier? Is there something that we should prepare for? But at least in that realm, I don't see a trend of more states moving towards licensure for RBTs. One area that I think there may be some room to examine might be the assistant behavior analyst. When you look at the numbers in Kansas, while we have 2 levels of permanent licensure for behavior analysts, the number of assistant behavior analysts is a much smaller number, and that number really doesn't appear to be growing. I don't really know a lot of the history of that level of licensure. It just, that is one thing that has caught my attention. There are a fair number of states that do license assistant behavior analysts, but it does not seem to be a group that is growing in Kansas. And so perhaps at some point in the future, it might be worth a conversation to talk about the LABAs versus the LBAs.
yeah, it's probably because Kansas did not start off recognizing a tiered system of service delivery, which made the BCABA a little bit irrelevant. And so so that's probably what continues to keep that position in a minuscule state.
It
Because
wasn't until until a BC ABA can be an autism specialist that I feel like people have recognized the value of them, and we have one among
yes,
them. So
yeah, I
they
mean,
do
there's a
recognize
handful
the
of them,
value.
yeah, but you know, maybe it's something that as practitioners in the field, we could, when we're talking to RBTs, we could say, hey, you know, you could go and get this. You don't have to go to school and get your master's degree. You could do this. So we could try to talk it up some, but that's my 2 cents.
But I think the conference was good. Last year it was really helpful for me to get a better understanding of your profession. And I think this year, as long as they're going to continue to keep part of the conference specifically for regulators, I think it makes sense for us to continue to go there and bring back items for you all. So
Yeah,
there's other things, we'll try to bring them to future meetings and kind of share some of the ideas with you.
yeah. Anyone have any other questions?
I have a quick question because I was
Yeah.
there too. I went to the billing, whatever it was, meeting that they had, and we discussed potential consultation codes for hospital-based folks and those going out
Oh,
to
awesome.
do quick stuff. And they made it really clear, as if we didn't know already, but that our profession is not autism specific. Neither are the billing codes. And I was wondering if there was anything that is going on in the legislature of Kansas or anything that we can advise on that would promote, I guess, diagnostic free understanding of what we do, and because and Allison, yeah, as you're raising your hand, because you also mentioned, which sparked this, was that you can become an autism specialist, and then all of a sudden the BACB or the BCABA becomes relevant, and it's interesting that once autism gets tied to things, then things happen. If there's any collaboration or lobbying that goes on to try and get insurance and other folks to understand that we do things far beyond autism.
Yeah.
I don't know if there's necessarily anything in the works right this moment, but I'm stirring the pot. I'm so sorry, y'all. I did start a conversation with David and Aaron Norris about TCMs, which led me to like really thoroughly read our licensure law so that I could cite it back to them. And realize that autism is written into our licensure law as well, and that it's autism specific. And it defines behavior analysis as autism as well. There's an autism line definition in there as well. So I think that it's worth mentioning that that is going to be an advocacy point for me over the next several years, maybe not tied to this committee specifically, or Kansaba or Kansas Grassroots, but as a consumer to protect those that need behavior analytic services. Because right now, I'll just give you guys the information, TCMs are out there writing behavior plans that are using functions and that aren't functions, and writing behavior plans that have consequence procedures that are using extinction inappropriately for some like severe problematic behavior. And so if our licensure law was written in order to protect consumers of behavior analytic services, we're missing a gigantic piece of them with our current ones. And so being able to advocate, I'm not advocating that we reopen our licensure law, but being able to add in some exclusions or rewrite that autism is specific, I think is going to be necessary over the next several years. I literally just sent that email last week, David. So it's just now coming up, but I think that that's a good point, that we are tied to autism with our licensure as well. So.
What is TCM?
Targeted case
Case
management.
manager. Sorry. It's I don't know how to describe a TCM. Basically, go ahead.
I tried to Google it and it said it stands for traditional Chinese medicine.
It sure doesn't. It is targeted case manager. Typically, they have Medicaid. They have a person-centered support plan that includes if they take psychotropic meds or have behaviors that are to be reduced. The TCMs are the ones that are writing behavior support plans for them. And I found it especially interesting that the IDD licensing manager also differentiated between behavior support plans and positive behavior support plans, because there is a difference, right? In our licensure and otherwise. So anyway, TCMs just means that they're in charge of their person-centered support plans as part of their, I think they have to be on a waiver in order to have a TCM. I might be wrong about that.
In order to be, they have to be Medicaid eligible.
Yes.
To get TCM services.
Medicaid.
Yeah.
Yeah.
Who are providing the TCM? That's like a job title or position, right? What other license? Who are the people?
It's people, you need to have a bachelor's degree or the equivalent, like so many hours. There's a specific training that you have to take, and there's you have to have at least, it's very minimal. You have to have at least one contact hour with clients per month. It's not really designed to be an intervention position. It's designed to be a position that helps manage the care around the person. So they find resources, right? They write the plan. They say this person needs, blah, blah, blah. They don't prescribe medication. They just, they may make recommendations to a psychiatrist or an MD. They do stuff like help identify where there would be an activity like Special Olympics that's coming, or where they could go get a haircut. It's more those what they call quality of life indicators that surround the person. They're not trained, as Allison said, in behavior support strategies or behavioral function or plan development. In my experience with their plans, none of their plans, unless they come through the PBS training, none of their plans identify a replacement behavior that serves the same function, because they're not about teaching. They have goals for the consumer, but it's based on consumer. It's like the consumer says, I want to be a horse trainer when I grow up. And so that's the goal. The goal is that we engage in activities to work them towards potentially working with animals somewhere. So it's not a direct service, but they're put in the position that they have to develop a plan that is part of direct service, which is a behavior management plan, and without any guidance or training. So I am personally and professionally, not as a member of this board, behind the concept of advocacy related to getting the state to either put something in there that the TCM needs to coordinate with a behavior analyst or somebody with behavioral expertise, right? In order to be able to develop that plan, or they need to document and demonstrate that they have had advanced training in how to do a functional behavior assessment, identify function, develop an appropriate function-based behavior intervention plan that includes the replacement behavior. So, you know, we don't, the challenge is they are a credentialed class of providers, but they're not under our umbrella. They're under a different umbrella. And so it's the state of Kansas that acknowledges their training and education.
I can tell you, yeah, there's a specific IDD, because this is specific to individuals with IDD is what I was working on it, which is why I involved Aaron Norris in it. But there's specific like policies in place from KDADs on TCMs being responsible for the entirety of the PCSP, and that some agencies will hire behavior specialists, which again, I have questions about how they're eligible to do that when they are not then licensed by the BSRB to protect those consumers. And I'm sure that some of them are behavior analysts. Please don't misunderstand me when I say that, but a behavior specialist for this TCM agency that's writing FBAs, and then the TCM is taking their FBAs and their insight and putting it into a behavior support plan. So my question originally was about like, how is, when there's exclusions specific to OTs and speech therapists and autism specialists and, but there's not for these TCMs, how is that not in like fighting the licensure law? You know what I mean?
Well, yeah, probably when we got the, it's probably because in reality, when we were working to make sure, originally, for those of you that may or may not remember that were involved with this, the original bill was not introduced by the field. It was introduced by the insurance companies, because we had come out with a state mandate that they needed to cover insurance, and there was, and I think this was part of their bid to offset the potential impact fiscal impact of starting to provide coverage for autism treatment. And so by the time we heard about it, there was very limited time to be able to pull stuff together. And the groups that are listed as exclusions in the bill were those people that were already working with individuals with autism in a therapeutic sense. And they were like, hey, wait a minute, I'm an OT and I work with kids on motor control. I don't want to be excluded from being able to continue that practice because I'm not a behavior analyst. And so those were the groups that were in attendance at some of the hearings. TCMs were not represented there because they don't provide direct service. They're not a direct service provider. And I think that's probably why they weren't included in there as a class of exemption. And so it may help you understand, it doesn't mean that it's right that we have, people running around trying to do stuff, right? But understanding where it came from and why they probably weren't in there is at least knowledge of how it came about. And then, like David said, there's, like these things get passed and then there's multiple changes or challenges or problems with it that have to be addressed. And I think the way that we addressed some of that initially was through the rules and regulations. And I think Claudia was a member of that group at the time, and Mike Wassmer when we were coming up with the rules and regs. So, it's got a little bit of a complicated history, but the reality of it is that, what do, professionally as the advisory board, is there anything that we can recommend or advise on or whatever, or even address, like, present to a group, which sort of kind of feeds into one of the other questions that under new business, it's pretty similar to under new business item B is, what is a behavior analyst and who is it that can call themselves a behavior analyst? And it's, what's it called? Practice protection? Is that it? What it is, David?
Well, there's two things. There's practice protection and then there's title protection.
Yeah.
And most of the professions basically say you're not able to do these things unless you are licensed, and then there are some carve out of the exceptions. But then for some of the professions, it says you're not able to call yourself a licensed professional counselor or a professional counselor unless you are licensed under the BSRB as a professional counselor. But not all professions have title protection. And so
guess who doesn't?
I was like, do behavior. So that's the thing too, is that TCMs aren't claiming to be behavior analysts. They're just doing the job. So
right.
That's the piece that I'm like caught up on. Like, how does that not apply?
But I think they're both part of the same thing in terms of they're important and they weren't included in the bill. And
but
because
my thing is, if they weren't included in the bill as an exception, how are they still doing that then? Because they're not an exception into the bill. So they should fall under the purview of that licensure law.
Or it falls under the purview of their current license or their current credential, which part of the function of a TCM is to create a behavior support plan to address the needs of the consumers they serve.
Okay.
So it, I mean, that's how they can do it. It's because that strategy historically was relegated to TCMs. When we became licensed, now that's part of what we do in our practice. And so we want to make sure that people have appropriate care. That's that do no harm, right? So I'm not
anyway,
sure.
I'm going to be annoying about this for the next 5 years. So
that's okay.
get ready for it.
we should talk about it offline, not as members of the Behavior Analyst Advisory Committee, but as concerned behavior analysts practicing out in the field. But also, like, in addition to who has the authority to develop and implement a function-based behavior intervention plan, and who has the right to call themselves a behavior analyst. So we have practice protection and title protection, because there are people out there right now that are calling themselves behavior analysts, and they're not. So, and the BACB says it's our jurisdiction to talk about it. But, so we should talk about it. Right, David?
I think it's a good time to talk about it. Yeah. And I realize that we're probably going to be tight on topics with our old business.
So sorry.
New business. That's okay. This is a good discussion. I mean, this is a good opportunity to talk about things relevant to the behavior analysis profession. And that's why we have these committees. So it's good.
Mhm.
I do want to, I know we have a few different items in a different order, but Linda, if it's okay with you, maybe we can table the old business items and then just move to the survey report.
Yeah, I think that ends on a high note.
Yeah, and I think maybe some of the items in the survey report might spark some further discussion on things like artificial intelligence and topics for future meetings.
Mhm.
So maybe we can just kind of move to the survey report.
Yeah.
And then kind of pick up with some other items the next meeting then.
Yeah,
Did
I
you need
think
someone to still share them for you?
Yes. If somebody could go ahead and share their screen with the copy of the report, and then we can walk through that together.
Thank you, Allison. While you guys are doing that, I'm going to go get some more water. I'll be right back.
You guys don't need to see all my emails, so let me pull it on its own screen.
I want to hang that on my door wall. How to be a nice person.
Oh. Did that work?
There it is. Yeah. Is there a way that you can make that a little bit bigger?
Yeah, hold on just a second.
Okay.
Let me close out everything because I don't want to accidentally do something stupid.
And maybe that's good for everybody. I can see it at this size. Okay. That sounds good. Well, thank you. As you recall, we put together a survey. We did modify a few of the questions to try to get some similar language between professions. The survey basically it starts with, and this is a draft report, so this is not the final version, but we wanted to get it in front of you today so that you could take a look at it. This page here just kind of describes the process by which we went by to. Allison, did you say you have a question or?
No, I'm so sorry. I was trying to make sure it's not letting me see what you guys see. And so I just have it on my screen. It looks very weird for me. So I was just trying to figure out it's fine. Sorry.
No problem. Yeah, so we basically explained here that we had surveyed social workers first, and then inspired by that, we surveyed the other 6 professions. We also tried to have some different questions between levels of licensure. And then as of January 2025, the number of licensees in the behavior analysis profession in Kansas totaled 506. The LABAs, there were 18 of those, and then LBAs, there were 488. And then we held up in the survey for about a month, from January 24th until February 23rd. And then, so basically in those 31 days, we sent a few follow-up reminders, used SurveyMonkey as the licensing tool. And basically the reminders were sent out about a week. Those were targeted to people who had not completed the survey. It was set up so that we were not able to match responses to individuals, but we could see who hadn't completed the survey yet, so we could just send out the reminders to those people. And then basically over the time period, 71 individuals completed the survey for an overall response rate of about 14%. That was a little bit lower than some of the other professions. For the LABAs, we only had 3 people complete the survey for a response rate of about 16 or 17%. And then for the LBAs, 68 individuals completed the survey for a response rate of about 14%. So as I mentioned, some of the other professions were a bit higher, somewhere around 30%. But we were still happy to kind of collect some data and then use that as a base. Hopefully we'll be able to do another survey some point in the future, and then we can kind of build off that. We realize this might have been the first time that some of these licensees have been surveyed, and so hopefully they'll see the benefit of this type of report, and they'll be more likely to respond to future surveys. But question 1, we asked both groups, in what Kansas counties do you provide professional services in the behavior analysis profession? 3 LBAs or LABAs indicated their responses. And what we did with this survey report too, in the past for the social work surveys, what we have done for the reports is just had each question followed by all the answers. We didn't want people to get bogged down in some of the open field responses. So what we tried to do was summarize those responses, but we still wanted you to see the responses, especially with the voice of the people who responded to the survey. So every one of those open field answers is attached as an appendices on the back. And so so basically it says here what the summary was, and then it says what the where you can find the appendix for the full information. And for question 2, it was similar. The LBAs, Allison, do you mind going up just a little bit to question 1
I
again?
can tell where you were. I thought you had moved on to question 2. I'm so sorry.
That's okay. So the
I was
question,
the wrong person to do this. I'm so sorry.
no problem at all. So for the 3 LABAs, they basically referenced a combination of counties. The one that they mentioned separately was Sedgwick County, which is one of the most populous counties in Kansas, so that made sense. The 67 LBAs, they provided mostly a combination of counties, but the most frequently referenced single counties included Johnson County with 14 individuals and Sedgwick with 7, which also makes sense as major population centers. But if you wanted to see the combinations that people had listed, that is in Appendix 2 on page 25. And then moving on to question 2, we asked both groups, do you practice in a predominantly urban area, rural area, or frontier area? 2 of the LABAs mentioned urban, 1 rural, and then for the LBAs, 67 individuals responded to the survey. The largest amount, 57%, reported living in an urban area, followed by individuals living in a rural area at 31%. And just as a side note, I did look up the 2020 census, and I believe 57% of Kansans report living in an urban area. So that does basically track with the 2020 census. So,
Can I ask a dumb question?
Sure.
What is frontier?
So frontier is an area that is it is less populated than rural, and there are a few different definitions that you can find online, but it is meant to be very remote. So rural areas, but there's less than, I think, 4 people per certain geographic region, and so we included it for some of the larger professions just to kind of see who all was out there in the frontier areas, but people may not be familiar with that term. So people may have avoided that answer if they weren't familiar with what a frontier area was. Go ahead and move to question 3. Okay. So question 3, we asked both groups, do you primarily work in public practice, private practice, educational setting, or another setting? All 3 LABAs mentioned they work in private practice. For the LBAs, we had 68 individuals who answered the question. Most popular response was private practice with 41%. It was interesting that the next most common answer was sort of a tie between public practice and education at 22%. And then all the other answers were, well, I guess other at 10%, and then preferring not to answer around 5%. But that number of individuals working in education was a higher percentage than I think what I've seen with the other professions. So that was kind of interesting. Go ahead and move to question 4. Question 4, it said, question asked, how many years have you practiced behavior analysis or in the behavior analysis profession? And then it said, if applicable, you may include years practicing behavior analysis in other states. For the 3 LABAs, it was kind of interesting to see there was one that was over 10 years, one between 5 and 10 years, and one between 2 and 5 years. So pretty good sampling there. For the LBAs, The most common answer was individuals practicing over 10 years with about 50%, and then between 5 and 10 years, 31%, and then between 3 years and 5 years, 13%. And so I think what you'll see with the other professions is that over 10 years does tend to be the most common answer. But I thought this slope was a pretty solid slope. For some of the other professions, you see a much bigger gap where the vast majority have been practicing for over 10 years and not a lot of new entrants into the profession. Here, it looks like there's a nice group of individuals that are continuing to enter and at different stages there.
I was actually really surprised by this one because historically our profession has said that like most behavior, like more than 50% of the population of behavior analysts is practiced less than 5 years. So seeing that that's not true of Kansas was kind of interesting.
Yeah.
I also wonder if maybe some of these baby BCBAs did not complete the survey.
Yeah. Well, and the response rate was low. It was still 14% or so. But so I'm not sure I can say it's representative of the entire licensing group. But yeah, it was nice to see there was a slope there like that. So, go ahead and move to the next question. Question 5. So we said, including Kansas, and how many states are you licensed, certified, registered, or essentially authorized to provide behavior analysis services between different states? All 3 of the LABAs, or I guess 2 of them, answered this question. The 2 LABAs that answered this question said 1 state, just Kansas. For the LBAs, I thought it was interesting. There was a split for the most common answer. 41% said 1 state, and also 41% said 2 states. Now, if you're working in a city that borders 2 different states, that makes sense. And then about 12% said between 3 to 5 states. So, but I think that number of individuals who are providing services in more than 1 state is probably a higher ratio than what you're going to see for some of the other professions if you see a comparative report at the end. So.
I want to know how that person who is 6 to 10 states keeps up with all their licenses. It's hard enough keeping up with 2. And plus the psych license. So
yeah, that's a good.
And the BCBA, because you do the BCBA plus the state license. Anyway.
Yeah, 6 to
that's
10.
a lot.
It's a lot. I agree. Let's go to the next question here. Okay, so now we're going to get to some open field, and this is definitely a draft page. Got some formatting issues, so we couldn't list the appendices, but if you go to the back, you can reference those. Question 6 asked, do you maintain an active license but no longer work as an LABA or an LBA? If so, please explain why you are not providing services currently. And part of the reason we included this question is we have good data in terms of the growth of licensees. And we have mentioned a few times that over the last 9.5 years, our total number of licensees that we regulate has grown from about 12,000 to over 16,000. So when people say there's a workforce shortage, and we say, well, we hear that, we understand that, but we have put 4,000 more licensees out into the field over the last 9 years, not just, not counting people who have let their license expired, but even taking that, like this is the net. There's 4,000 higher licensee totals than 9 years ago. But we also know that there has been a transition and people are moving to a higher level of license. People are staying in school longer. And the idea has been perhaps there are some people that hold a license but may not work in that field providing direct services. For example, I have an active law license. I'm an attorney, but I'm not in front of a judge every day. I use my law license in what I do, but I'm not officially an attorney for the board. So we wanted to kind of get an idea, are there a lot of people out there that may continue to keep their license active but are not providing services? The 3 LABAs answered the question. They basically said it did not apply to them because they are all still providing services. For the LBAs, 46 of them answered the question. They identified reasons why individuals might maintain an active license without providing service. 41 of the 46 indicated that they were still providing services. But of those who indicated that did not apply to them, 5 responded. some of the reasons what were listed, including providing services is not part of their current job or low pay for the profession. And they also reported that individuals maintain their license to supervise others rather than providing direct services. For question 7, that was just for the LABA. And we asked, are you taking steps to pursue a licensed behavior analyst license in Kansas? And if you're not taking steps to pursue an LBA license, could you explain why you made that decision? 2 of the individuals basically say that they are just about there and they are taking steps to do that. One individual noted they're not pursuing an LBA license because they don't want to go back to college at this age. This was a question that we asked a few different groups of people. In Kansas, we are a bit unique in that we have 2 levels of permanent license for professional counseling, marriage and family therapy, master's level psychology, and also behavior analysis. And people had questions, why are people staying at the non-clinical level for some of the other professions? And we thought this would be helpful to include for the LABAs too, to ask them, are you working towards an LBA? Or if you're not, why not? And so it seemed at least for one person, it was because of maybe the cost or the time or whatever is involved with going back to college at their age. And you can move to question 8. So for question 8, for LABAs, and that's question 7 for the LBAs, in a typical week, how many hours do you provide in-person services to clients? So for the 3 of the LABAs answered the question. 2 of them said that the vast majority of their time, 20 to 40 hours, was providing direct services to clients. One mentioned that less than 5 hours per week was providing services. For the LBAs, the largest percentage was 35%, and that is individuals who are providing between 20 hours to 40 hours per week. The next highest percentage is individuals providing less than 5 hours per week. And then there was sort of a tie at about 15% for individuals providing 5 to 10 hours and individuals providing 10 to 20 hours. So sort of a broad spread across the different categories there. Yeah, you can go ahead and move to question 9. For question 9, we asked both groups in a typical week, how many hours do you provide telehealth or remote services to clients? For the LABAs, 2 of them basically said that's not something that they spend a lot of time on per week, less than 5 hours. But one of the LABAs did say they spend between 20 to 40 hours providing telehealth or remote services. For the LBAs, 67 individuals responded to the survey. The most common answer was less than 5 hours at 63%. And then between 5 to 10% was the next one at 20% or 19%. So it appears that remote or teleservices are not where the majority of the LBAs, at least that responded to the survey, that's not where they're really spending the majority of their time. And then we asked this question just to the LBAs. So now our question numbering is going to get back on track after this. It said in a typical week, how many hours of services implemented by these, say, ABAs or RBTs are you responsible for overseeing or managing? For the LBA, the responses, there were 67 individuals who answered the question. The majority of the respondents, 34%, or the highest percentage anyway, was less than 5 hours per week. Are they responsible for overseeing or managing the work of other people? The next most common answer was about 22%, and that is individuals who spend between 20 to 40 hours. I did find it interesting that about 21% said they spend more than 40 hours per week overseeing and managing individuals. And then about 12% said they spend between 10 and 20 hours per week overseeing the work of other people. So
I'll be honest, I think this question was worded weirdly because I think I'm one of the people that answered more than 40 because
Okay.
like I'm responsible for more than 40 hours because like my team does like 300 here. Does that make
okay.
sense? But
So-
I'm not spending that many hours. Does that make sense? What I'm saying?
Yes.
So I think this question was worded weirdly, and I don't know if that is super accurate.
I see. Okay, well, that's
And
good.
I think we talked about that though, didn't we? That there's some people that are responsible for, you know, oversight, like clinical directors and whatnot.
I agree. I think that this is the purpose of that question.
Yeah.
That's my memory of the discussion as well, that this was aimed at that.
So then I'm confused as to why people were supervising less than 5%. Then I guess, does that make sense? Like this question, I don't know if this question is going to give us a whole lot of information, is what I'm saying.
I was just surprised to see 21% respond to more than 40 hours. So, okay. Okay, well,
A lot of people said they were in education too, right? So
Yeah.
then they're maybe not overseeing BC ABAs and RBTs specifically. They might be overseeing BCBAs or autism specialists or
yeah,
other students. Yeah.
yeah. I think
And that
over
would be less than 5 hours. Yeah.
Okay. Yeah, I think you're right. I think over 20% had responded their primary field was education. So, okay. Well, moving on to question 10. Question 10 asks both groups, do you anticipate retiring from the behavior analysis profession in the next 5 years? All three LABAs said no. And then for the LBAs, 59 individuals answered the question. The most common answer was no, with 84%, followed by another 10% that were unsure. And just to tell you, compared to some of the other professions, that number of unsure is pretty consistent. I'd say between 10 to 15% across the board per profession, people don't know, which 5 years is a long time. Hard to know where people are going to fall in 5 years. But I think it is probably a good sign to see that 84% feel confident saying no. And if the unsure are also end up being no, that means there's a lot of stability in the field, at least for the next few years. Alternatively, if the unsures are yes, that still only comes out to about 15%. So as you're adding more people to the field, even if you did see a decrease of people, the net would still probably be pretty good. So question 11 for both groups. Currently, no multi-state compact exists for the behavior analyst profession. If a multi-state compact is created under a model that would allow individuals to practice in other compact states by changing from a single state license to a multi-state license for an additional cost, would you be interested in obtaining a multi-state license under such a compact? Please explain. And so the three LABAs answered the question. The appendix on page 30 has their full responses. But to summarize, they all expressed positive remarks in support of a future multi-state compact. Some of the reasons they were positive on this item included mobility involving having a military spouse and moving around, and also working for companies that have agencies in multiple states. Also for the LBA responses, 67 individuals answered the question. That can be found on appendix 7 on page 31. The vast majority of those individuals, 51, expressed support for a multi-state compact. Some of the reasons listed by the advocates for the compact included ease of practicing across state lines, interest in performing teletherapy in surrounding states, ability to work in Kansas and bordering states specifically, decreased costs compared to purchasing licenses in multiple states, easier than pursuing licensure in other states. It was noted from one individual that pursuing licensure in another state has been a very long process, and additional employment opportunities. About 8 LBAs stated they were unsure whether they would be interested in a multi-state license. Some stated they would need more information on the specific cost, or that it was early in their career and they were not sure they would actually need it. And then about 8 people were not interested in the license if it was a multi-state. Some of the reasons that they cited not being interested in it is they only are working in Kansas, so it's not needed to fulfill their current job responsibilities, and lack of time to work in multiple locations or pursue other employment opportunities.
Well, I think if you add the 8 to the 51, that's a pretty good indication that we favor mobility.
Yeah, I think there'd be a lot of support. This model that was talked about was the model for the social work compact, and that is one of the complicating things too. There's 3 current compacts for the BSRB professions. and they're all a little bit different, but I think the most popular one has been the social work model and with a multi-state license. So that was the model we put in front of them, and that was what they weighed in on. So go ahead and move to the next question. And Allison, appreciate you doing this again. So thank you. Question 12, for both groups, we said the Kansas statute 74-7501 specifically identifies BSRB board members from other professions such as social work and psychology, but does not list a behavior analyst on the board. And we mentioned that we were pursuing legislation to add a 13th board member, naming a behavior analyst as a board member. And given the public protection mission of the board, please explain if you would support the board's request to add a board member for the behavior analyst profession and what impact adding a board member for the behavior analysis profession would mean. So for the 3 LABAs, they did answer this question. All respondents expressed support for adding a behavior analyst to the board. Some individuals noted this would help in recognizing the behavior analysis profession as a separate profession, and it would add pertinent knowledge to the board of the BSRB. The LBA responses, 62 individuals responded to the question. The vast majority of respondents expressed support for adding a behavior analyst to the board. Some of the reasons identified included advocacy for the behavior analysis profession, fairness for a regulated profession to have a member on the licensing board, adding a voice of a behavior analyst to assist in deciding disciplinary issues involving behavior analysts, adding a unique perspective from members of other mental health professions, and more visibility for the profession. As I was reading through some of those responses, I know this is kind of something that's come up in the advisory committee before, but I do think it's interesting as we're helping more licensees become aware of the advisory committees. You know, advocacy is really not the purpose of having the board members for different professions. We talk about the difference between a regulatory board versus an association, and that it's really not an advocacy group, but I do feel a lot of passion from the licensees and wanting to make sure that, you know, the profession does well and that there are voices of people that are knowledgeable about the profession and can speak to some of the unique aspects of it. So just thought I'd kind of share some of those comments, but advocacy was one of the major items people talked about. We can move to the next question. Question 13, we asked both groups to assist the work of the board. The BSRB has 7 standing advisory committees, one for each of the 7 professions regulated by the board, which are primarily composed of licensees in each profession. Advisory committees discuss topics relevant to the work of the board and make recommendations back to the board on potential changes to statutes and regulations for the profession. These meetings are broadcast on the BSRB YouTube channel every other month. On a scale of 1 to 10, how familiar are you with the work of the Behavior Analyst Advisory Committee? 2 of the LABAs said they were not familiar. 1 said they were completely familiar. For the LBAs that responded, 68 individuals answered the question. The majority noted no familiarity with the committee, 52%, followed by individuals noting some familiarity, 21%.
That's sad.
And then 10% said they were completely familiar or very familiar with 10%. This is not.
Don't we send out an email asking for people to join?
We do. Every time that we add to the advisory committee, it gets sent out to all licensees. And you know, these numbers are not very different. In fact, they might actually be a little bit better than some of the other professions. But we were, you know, I think even though it's unfortunate that more people aren't aware of the work of the advisory committees, I want you all to know that your work is very important. And I think just by asking this question on the survey, it puts a spotlight on the work of the advisory committee and letting people know that those meetings are available to watch on the YouTube channel. For some of the other professions, some of the comments we got back reflected similar numbers to this, but in the catch-all responses, they said, I appreciate you letting us know about those meetings. I wasn't aware of that, but I'll make more of an effort to follow the work of the advisory committee. So I think just asking this question helps put it on people's radar. And so I think it'll show some positive outcomes just by including this and putting it on, you know, in a little spotlight on it. Question 14, for both professions, or both levels of license, the BSRB is governed by the state statutes and regulations, including unprofessional conduct regulations. The Kansas Unprofessional Conduct Regulations for LBA licensees differ from the ethics code of national associations for the profession, such as the ethics code for the Behavior Analyst Certification Board. How familiar are you with the Kansas Unprofessional Conduct Regulations? So all three LABAs said they were very familiar with the Unprofessional Conduct Regulations, which was great to hear. For the LBAs, 68 individuals answered the question, and you've got a pretty reasonable slope there in terms of that curve. The number one answer was 27% with an average level of familiarity. 25% said they were somewhat familiar, 22% said they were very familiar, and then you had about 10 or 12% that said they were either very familiar or completely familiar, or they were not familiar at all. So all things considered, this is good. We had talked a little bit about some of the differences between what people are held to as a licensee in terms of the unprofessional conduct regulations, whereas there's also the ethics code of the BACB. So it is helpful that, at least according to this, a fair amount of people are fairly familiar with the unprofessional conduct regulations.
Yeah. I'm sort of surprised that anybody answered not familiar. But I guess that's not unusual. It's unusual to me. But
You know, it's an anonymous survey, and so I can appreciate the honesty. But
I mean, yeah, good on him for telling the truth. But
yeah, hopefully they
surprising.
can get a good opportunity to dig a little deeper. So, yeah. Question, and maybe they were just brand new licensed, and they need
Fair
to
enough.
educate themselves. But
Correct.
question 15, LABAs and LBAs both were asked this question over the last 2 years based on your observations and experience practicing in the behavior and analysis profession. Could you share information on any practice-related issues you have seen, such as areas where practitioners appeared to need more continuing education or training in certain areas? Please explain. So for the 3 LABAs that answered the question, one respondent indicated having experienced no practice-related negative issues, which is good.
Yeah.
It's always happy to recognize some of the positive responses. But for the other 2, negative issues identified included experiencing a previous employer participating in unethical practices via billing for services they did not provide. It was also reported that issues have been seen in trauma-informed care and socio-guided needs.
Yep.
For the LBAs, 56 individuals answered the question. 3 individuals indicated they had experienced no practice-related negative issues, but for the individuals that did see practice-related negative issues, the common responses included supervision issues, agencies and/or individuals providing behavior analysis services without proper education and/or licensing, insurance issues, lack of staff support, billing fraud, burnout, or lack of consulting opportunities. And then, Allison, could you scroll down just a little bit? Additional items that were noted included ethical issues, such as practicing outside the scope and conflicts of interest. And then a wide range of areas needing more education or training were identified. And those included working with schools, just broad treatment, trauma-informed care, collaboration, autism, telehealth, managing RBTs, dual relationships, neuroaffirming care, behavior plan writing, and soft skills and assessment.
Yeah.
So a lot of different things.
And I just, and this may be idealistic of me, I just expect more out of behavior analysts than, I mean, billing fraud comes up. It's like often, it comes up often. And as a matter of fact, I think in Indiana, they've clamped down on behavior analysts because there was so much. When I was working in Alaska, there was somebody that got cited by Medicaid for Medicaid billing fraud. I'm just like,
I mean, Florida is rampant with it. So
yeah. I mean, I expect
shut their
more of
networks.
this.
So
I expect us to be idealistic, right? I expect us to, be out there promoting positive outcomes for the people we serve. Not
Sorry.
killing fraud. Sorry, Kelly, what?
No, you're fine. I was just going to ask, did other professions ask a similar question and have similar answers? Yeah.
Yeah. Yeah. And I think it'll be interesting. We'll be able to provide all their different reports and you can kind of see the different areas. Yeah. One thing I don't see here is the, sexual relationships with clients.
Great.
Yeah,
Love
that's something.
You see dual relationships mentioned, but thankfully, I'm just kind of looking at thinking in my mind as far as the different trends, and that is one that sometimes you do see for the other professions more.
But we may see this, Kelly, in other professions. But seriously, we're so new at this. Shouldn't we be like the shining example of how to do it right? I mean, why do we, I don't know. Knowing the science, it seems to me that we should be the exception to the rule. But like I said, that may be being idealistic of me.
Linda, the organism is always right.
That's true. And so when you have those competing contingencies, but still, it's like we should be able to arrange the environment to support the appropriate behavior. So
at least we're looking at it, right? I think that's the first step. And then from there, you can come up with a solution, hopefully. We grew really fast as a field too. And I also wonder how
growing
that did. Yeah.
Well, so this leads me back to the original part of David's executive director report where he's talking about the CEs and BSRB sanctioned CEs. It's like, I wonder if part of our role as an advisory committee is to solicit people that want to give talks for CE credits, because I'm sure that probably 75% of us on here are CE providers. And, maybe we could come up with some CEs around some of these issues.
Kanzaba can help with that too.
Huh?
I think Kanzaba would love to help with that too. We're bringing back our mini conferences again. So
yeah. So that would be awesome if that could be something that we decide that we want to take on, and identify people that could do a presentation related to each one of these, the supervisor issues. Everybody's always looking for supervision CEs and ethics, and several of these can be considered ethics.
Well, and I think Kelly brought up a good point. Part of it is asking the questions and collecting the information. And we can definitely target some of these. And we've talked about it with some of the other advisory committees. There might be things that are identified that are outside of our scope or our jurisdiction, but maybe that leads us to have conversations with new groups that we can share the data and then they can find the solution for it. So
and then get approved that can be housed on that, whatever that CE thing is, because aren't you doing, so I'll get on there and I'll say, come on guys, we're better than this.
It's just gonna be an hour of Linda yelling at us about
like, what the heck.
Well, we've got about 4 questions left. Maybe we can get to
I'll stop talking.
It's okay. This is a good conversation.
I'll mute myself.
We're so close to the end of this that I think some of this might spur some comments for the next time. So Allison, do you mind going to the next question?
Yes, so sorry.
Question 16, over the past 2 years, have you experienced any issues with telehealth, either through professional practice or observations of other practitioners? The 3 LABAs, 2 said they haven't experienced any issues with telehealth. The other one noted that there were problems billing for telehealth services. They noticed people billing for telehealth services when they were only doing phone calls. LBAs, 52 individuals responded. 32 individuals said they had experienced no issues with telehealth. Those who had seen or experienced issues, one of the major ones was insurance barriers. Other individuals noted providers only doing telehealth even when it's not in the client's best interest. Telehealth services being conducted with cameras off, access issues or issues with maintaining confidentiality and HIPAA compliance. And it was also reported that more guidance is needed on best practices for telehealth use. While some respondents expressed support for telehealth, others mentioned the importance of not doing 100% of services via telehealth. Go ahead and go to the next question. Question 17, in the last 2 years, have you experienced any negative issues with supervision? The LABAs, 2 of the individuals noted no issues with supervision. 1 individual reported negative issues involving supervision. Specifically, they had a supervisor who encouraged more reading or study hours than hours gaining real experience. 54 LBAs answered the question. 38 individuals noted no problems with supervision. But for the individuals who did, of the issues reported, the most frequently reported issues were experiencing inadequate supervision. More specifically, licensees reported a lack of constructive feedback and support from supervisors, and licensees being under-supervised. While these negative issues involved supervisors, there were comments regarding there being a lack of training and support for those in supervisor positions. And then while less frequently identified, other licensees pointed out the following issues: recruitment issues, burnout, poorly trained new licensees, general unprofessionalism and or unethical behaviors in practice, and RBTs being poorly trained and practicing without supervision. Next question. For question 18, do you currently use artificial intelligence in your practice? And if you do, what do you use for AI as a tool? For the ABAs, 2 respondents reported they do not use AI, and 1 individual did. No elaborations were made for any of the 3 answers. For the LBAs, 68 individuals answered the question. 49 said they don't use AI in their practice. However, the individuals who did note it mentioned being open to, after providing the response that they didn't use it, some respondents mentioned being open to learn more, while others reported needing more guidance and having privacy or security concerns. 13 LBAs reported they did use AI in their practice, and in terms of what they used it for, emails, scheduling, brainstorming, note-taking, social media purposes, policy guidance, and documentation. The last 2 questions here. Question 19, based on your experience as a licensee in Kansas, do you have any recommendations on additional ways the BSRB could protect and serve the consumers of services offered by BSRB licensees? The 3 LABAs answered the question. 2 individuals said they had no recommendations to provide, but the 1 other individual said was to have spontaneous check-ins at practices to ensure practitioners are in compliance with regulations. For the LBAs, 68 individuals answered. 26 noted they have no recommendations. Following list, the frequently reported recommendations provided by respondents: give more severe consequences to licensees who commit ethical violations, expand licensure, add a behavior analyst to the board, align BSRB and BACB renewal cycles and continuing education requirements, inform people on how and where to file a complaint, restrict behavior analysis services to those provided by licensed individuals, and offer continuing education, particularly in the area of risk assessment and suicide screening. And then question number 20, the last one on the survey. We had a catch-all. Do you have any other comments or feedback you would think would be helpful for the members of the Behavior Analyst Advisory Committee of the BSRB to receive when evaluating possible changes to the statutes and regulations for the behavior analysis profession? Please explain. 3 LABAs answered. They indicated no additional comments or feedback. For the LBAs, 38 responded. 25 said they don't have any additional comments or feedback. But for the individuals who did, it was frequently reported that adults with developmental disabilities do not get insurance coverage for services. It was also reported that insurance reimbursements need to be increased. Additionally, licensees recommended aligning BSRB and BACB license renewals and continuing education requirements. So, and the pages that follow, you can see we're only on page 23 of 56. All the other pages are just basically short appendices where they're open field responses. I tried to include as much of the answers as I could. If there were specific references to individuals or companies, I removed those just to make sure it all stayed anonymous. If there were positive notes about individuals, I left those in because those are always nice. But I try to take out things that would identify people who responded to the survey. But I do think reading these is going to be very helpful. I would encourage you all between now and the next meeting to go through these and read these. We tried to summarize the responses, which I think was a good approach. But if you read through these, you get more of an impression of the voice of the individual licensees who completed the survey. And I think sometimes the tone or the additional comments are really helpful, and you can pick up a lot from the additional comments. So
Yeah.
Yeah.
You know what would be nice, David? I think what would be helpful and actually would be for a variety of reasons is doing like a heat map on where people practice, because it will show where the gaps are. And maybe we could do specific reach outs or something, I don't know. Like, or Pam, maybe part of the focus of the program is going out there and recruiting people in different areas.
Mhm. Yeah, and
Anyway.
Alice, you
He's very mad about this. That was not me, I promise, but somebody is very upset.
well, and this
What
is
page is it?
35.
35. And this is what, you open yourself up to. The board becomes vulnerable when you do an open field response. But I say, I think it's encouraging the board had the confidence and were brave enough to do this, because
Yeah, absolutely.
there's a lot of groups that are accused of not listening to individuals. And I think the board really wanted to receive feedback. And some of that is positive feedback, and some of that is really challenging. But I think if there's issues, I think this can drive the work of the board and the advisory committee. And if people are answering honestly and genuinely, that's not bad. It gives us more work to do. So.
Sure. It's just such a strong word.
No, I was very pleased with these responses, and I was very pleased with what we got from other professions too. I think people spent a fair amount of time answering the survey and really being thoughtful with their answers. And like I said, some of them were really positive, some of them were really challenging and even negative. And I'm not saying that's a bad thing. It's helpful to kind of collect a broad range of thoughts and opinions.
Yeah.
So between now and the next meeting, if all of you could read through these appendices, I think it'd be really helpful for future conversations. And then we have had a topic on the agenda for the last few meetings as far as additional topics. I think when you review those might kind of spotlight some topics that we can work on in the advisory committee for the next year or so.
Can we add this TCM issue that I'm not going to come off of for the next 2 years, please, to our agenda?
We can.
I'm so sorry. I have to leave for another meeting, but
Yeah.
Thank you.
Bye, Alice.
Yeah, and I appreciate you all. I did want to make sure we got through the end of this, but I know we are short on time. So Linda, I think it's okay if we want to go ahead and table the other items until.
Okay. See, I knew that would help end on a high note, given our, previous discussions. So I would entertain, so is everybody okay? I think it's general consensus with moving the remainder of the items to next time. Yeah.
Yes.
Okay. And then at that point, I'll entertain a motion to adjourn.
Motion to adjourn.
And do I have a second?
Okay.
All right. There's a lot of seconds on
Everybody.
that one. All in favor? Say aye. Any opposition? All right. Motion carries. We'll see you Friday, June 13th at 1 o'clock.
All right.
Thanks, everyone.
Thank you.
Later.
Everybody. Bye.